This is a test for the hip flexors as a group, so you're going to have your patient lift their knee up towards their chest about that far. You may want to stabilize at their opposite shoulder. Hold and don't let me push your leg down, and I'll be pushing straight down towards the ground. This is a test for the iliopsoas separately, not as the hip group. So you're going to have your patient lift their knee up towards their chest as far as they can go, and then hold and push down, straight down towards the floor again. And again. This is a test for the internal rotators as a group. You're going to have your patient slightly internally rotate. Remember that you're following the femur that's internally rotating and not get mixed up by the leg. You're going to push the leg in towards this direction, so you're actually forcefully externally rotating as the patient is holding their leg in internal rotation. So my force is going to be with my left hand on the outside of her leg, and my stabilizing hand is my right hand. Next, we're going to test the external rotator, so I'm placing again her femur in external rotation slightly. My right hand now is going to produce the force on the inside of her leg, and my left hand is just going to stabilize here. So I'm pushing her leg into internal rotation, but she's holding external rotation, so I'm testing the external rotators. Now we're testing the psoas major individually. So the leg is going to be in flexion, abduction, and external rotation. I'm going to stabilize at her pelvis. Again, you're going to think about your lever arm. You may push here, which is noted in the book, but I'm going to go more proximal. And my direction of force is into extension and abduction. Okay, next we're testing the tensor fasciolata, so the muscle along here. The leg is going to be in flexion, abduction, and internal rotation this time. Again, you may stabilize at the pelvis, you may not. My pressure force is going to go into extension and adduction. So again, I may think about lever arm out here, or I may come in a little bit closer, and I'm going to start proximal for this patient, and I'm going to go into extension and adduction. Next, we're going to test the sartorius. So the lower extremity will be placed in flexion, abduction, and external rotation. And then we're really just going to unwind this. So my pressure, I'm more or less stabilizing with my left hand, but my pressure is going to be with my right hand, moving her lower extremity into internal rotation, extension, and adduction. So I'm kind of going in this direction, unwinding what we've put her in this position. So hold here. Next is the gluteus medius. So for this one, you're going to have the patient again put the the bottom leg into flexion. You're going to have them lift this leg into abduction, slight extension, and slight external rotation. These are all again slights. For this one, my pressure is going to be down into adduction and slightly into flexion. For the next one, we'll test the hip adductors as a group. So what I'm going to do is support the top leg by reaching under and kind of putting my hand underneath her knee. Now you can give me the weight of your leg. She can kind of make that leg heavy. The leg that we're going to be testing is actually the bottom leg, so I'm going to ask her to straighten this leg out and bring this leg up to meet the other leg. And then my pressure is going to be straight down into the table. The next muscle we'll do is the gluteus maximus. So you're going to have your patient bend their knee, kind of take the hamstrings off just slightly, and then lift your heel up towards the ceiling, taking the knee off the table. My stabilizing arm could be my right arm here at her pelvis if she needs it, and my force is going to be straight down towards the table. The next muscle we're going to do is the glute min. So what we're going to do is again have the lower extremity kind of in flexion, the bottom leg, so that helps stabilize the pelvis just a little so the patient doesn't rock back and forth. The patient's going to lift their leg straight into abduction, so go ahead and lift your leg straight up. And my pressure is going to go into adduction and slight extension. So I'm going to go here. My stabilizing hand is at the pelvis. Hold.